Pow. Welcome, good morning everybody. Thank you for joining us today. Public Health Network Cymru are celebrating their 10th year as a membership network. They've got over 2,500 members now, and they recently reached out to their members and asked, what do you want from the network? And really overwhelmingly, members told us they wanted an in-person event, and a priority topic for them was very much babies, children and young people's mental health and well-being. So here we are, really good to be here.
Parent-infant relationships are vitally important. They're building blocks of our future emotional well-being, mental health. They are so pivotal in outcomes throughout all of our life, but they're also really important for babies in the here and now. There's so much that every professional can do, and I guess the first step is seeing it as part of everybody's role. But most importantly, it's to provide that relationship to parents when they're during this very kind of pivotal stage of development, to make them feel welcome, to support them, to notice and to ask how they're doing, and to direct them to more help if it's needed.
So there's lots of things that schools can do to support children and young people's mental health and well-being. For example, things like building work into the curriculum, supporting the workforce to not only look after their own well-being, but also know how to promote a positive sense of well-being amongst their learners. We know that the school environment itself is really important, the culture, so things like mutual respect, enabling learners to have a voice in some of the decisions that are being made. All of those types of things a school can really think about and can help to promote children's mental health and well-being.
So I think the main message that I take home from today's conference is the importance of a whole age approach. It's been really great to hear information straight from conception all the way through to secondary school age, and also the impact that we can have through early intervention.
I think the key message I've taken this morning from someone like myself who's got a background in education is around the need for collaboration across the whole system. It's been so refreshing actually to hear colleagues this morning talking from a health background, from a schools background and from a community background and third sector, really talking about the same messages around the importance of supporting babies and children with their mental and emotional well-being. I think we all realise that it doesn't fall on one sector or organisation, and what's been so encouraging is to see how each of our individual policies and ways of working can come together to maximise the impact that we can all have.
So what I was looking to achieve from the conference today was to be around fellow public health professionals, learn more around the whole school approach to emotional and mental well-being, and generally just get a lot more information to help me in my current healthy schools role and be the best I can be essentially.
I'm really excited about this day. It's about building foundations, and from my perspective we've got to start with the first 1,000 days, but I suppose what's really come across is that actually what I'm saying is equally relevant throughout the lifespan. It is about those nurturing, empowering, safe and trusted relationships that really help all of our mental health and well-being, but they help babies when they need it the most.
I'd say it's been a really valuable experience attending the conference today. There's been a really big range of speakers. They've all been really engaging, and you've got a really good picture of what's happening across Wales.
I would definitely recommend this for the future for my colleagues. I'm looking forward to the next one already, and this one hasn't even finished yet, so yeah, very, very informative.